In this video, I'm going to be discussing the top 3 reasons I prescribe maxillary expanders in kids. Maxillary expanders are amazing because they can develop the jaw, meaning less extractions. They can correct crossbites for jaw asymmetries, and they can also increase airway so that there's less likelihood of sleep apnea later on in life. So let's talk a little bit more about expanders. Hi guys, this is Dr. Robert Passamano. I'm a board certified orthodontist. On the screen you're seeing 2 photos. The left side is the before, the right side is after 9 millimeters of expansion. So let's talk a little bit more about the reasons why we do expansion. One of the reasons that I prescribe maxillary expanders is for jaw development. This means that we are increasing the size of the jaw to accommodate more teeth. This means that we're going to have reduced crowding as well as reduce the need for extractions. When the arch is too small, we often see teeth battling for position. In this specific case, we are seeing the maxillary canines are getting a little too close to the upper lateral incisors, and the appearance often is that the lateral incisors start to point outward. That's an indication that we don't have enough arch width to accommodate all the teeth. And so since we don't want to do any extractions here, we're going to expand the arch along with braces to make more space. On the right side of this slide, we are seeing that the canines have turned. The left one is fully vertical, which is amazing to see. The right one has turned quite a bit and it's almost vertical. And this is exactly what we want to see when we do the expander and braces. Here's another example of crowding in the canine and lateral area due to lack of arch width. In this specific case, we did the expander to make more room. We can see that the canines on the top were more diagonal, and then on the bottom image, they're more vertical like they're supposed to be, so that way the canines can erupt normal, and that's exactly what we want to happen. The next reason why I prescribe maxillary expanders is for crossbites and narrow arches. If the arch is too narrow, sometimes the jaw is asymmetrical, meaning it will go either to the right or left. If there's a dental crossbite, sometimes that causes TMJ issues or biting issues, so it's best to correct that as well. When the upper jaw is not fully developed, we often see something called dental crossbites where teeth are on the wrong side. And sometimes that goes even further, and we're seeing a jaw asymmetry. On the left side of this slide, we're seeing a 4 millimeter jaw asymmetry where the lower chin is too far to the left. On the right-hand side, after the 9 millimeters of expansion, we are seeing that the lower jaw has repositioned more centered and the jaw asymmetry is gone. This patient has an underdeveloped upper jaw, resulting in a complete right side crossbite. Using a maxillary expander and braces, we're able to correct both the posterior crossbite as well as the anterior crossbite, and now she has an amazing smile. This is a great example of what expanders can do. There's a great book called Breath by James Nestor, where he discusses the benefits of nasal breathing over mouth breathing. Nasal breathers usually have wider arches. Mouth breathers usually have more constricted arches. There's a lot of health benefits to nasal breathing, and maxillary expansion can definitely help nasal breathing. This 2013 article in the American Journal of Orthodontics discusses how maxillary expansion improves nasal airway ventilation, making it easier to breathe through the nose. Maxillary expansion not only reduces nasal obstruction, but also raises the tongue posture. And when the tongue posture is raised, it allows for a more wide maxillary arch. In this 2015 article in the Angle Orthodontic Journal, there was maxillary expansion performed in subjects that had posterior crossbites, and the oxygen saturation improved greatly, just showing one of the benefits of maxillary expansion. In this 2006 article in the American Journal of Rhinology, they demonstrated that maxillary expansion is effective in widening the nasal cavity. This means that the expander widens the palate, the floor of the nose is connected to the palate, and therefore the nose or nasal cavity increases in size. So one of the secondary benefits of expansion is also increasing the size of the nasal cavity, making it easier to breathe through the nose. As part of my normal orthodontic exam for kids, we take a lateral cephalometric x-ray to look at the profile. On those x-rays, we can also evaluate the airway, so we're going to take a look at the tonsils. Adenoids are lymphoid tissue similar to tonsils. They can be enlarged or normal size. If they are enlarged like it is on the left-hand side of the screen, circled in blue, it does impact and reduce nasal breathing. In this case, I would refer to the ENT, ear, nose, and throat doctor for an evaluation for removal of adenoid tissue. On the right-hand side of the screen, we are seeing a very open and normal airway. This person has probably no issues breathing through the nose. On the left x-ray image, we are seeing a very large adenoid tissue. It is so big that it is touching the other side, making it nearly impossible to breathe through the nose. This is an immediate referral to the ENT for removal. The hope is that this patient can start to breathe through the nose and have normal development. Thank you guys for watching the top 3 reasons I prescribe maxillary expanders for kids. I hope that you found it helpful. Hopefully you learned something about the benefits of maxillary expansion. It's quite amazing what this little device can do. So hopefully we all learned something a little bit more. So if you guys found it helpful, please help me out, like and subscribe the video, and I'll see you on the next one. Bye-bye.